Martha.
Well, thank you, Rachel. Thank you for inviting Missouri Family Health Council to come on and speak with folks in your network. We really appreciate the opportunity to talk to folks about the different resources that we have through Missouri Family Health Council, and then also to talk about sexual and reproductive health care in terms of policy as well and the landscape here in Missouri. So I really appreciate the opportunity. So I'm just going to jump right in, and everyone, the screen's working. Rachel, okay. Okay, cool. All right, so I'm just gonna jump in here. One moment. Folks, a little bit of an overview about our organization. So Missouri Family Health Council, we are a private non-for-profit organization. We're based in Jefferson City. And for over the last 40 years, we have served as the state's sole Title X Family Planning Program grantee, working to increase access to affordable sexual and reproductive health services, improve infant and maternal health, reduce STIs, and break down barriers for care for Missourians. So we have been a long-time dedicated steward of the Title X program, which I'll talk about more in the presentation. And so we administer that program. We are also committed to ensuring contraceptive equity and equitable healthcare access for every individual, which is why we are also proud to lead the Right Time Initiative, which I'll do a deeper dive with that in the presentation, as well as our new Free EC project. And we'll go into more detail about that in a little bit. But our work is really grounded in the reproductive justice framework. If you're not familiar with that term, that framework, it was coined in 1994 by the group SisterSong, which is the largest national multi-ethnic reproductive justice collective. And really that framework promotes maintain personal bodily autonomy, the right to have children, to not have children, and to parent children we have in safe and sustainable communities. The agenda today, we're going to do a bit of an overview of the current policy environment around sexual and reproductive health here in Missouri. I'll talk about the availability of current sexual and reproductive healthcare safety net services in Missouri, and then talk a little bit about staying informed and engaged in this work in our state. So we're going to just kind of jump right in to the current policy environment for sexual and reproductive healthcare, specifically in a post-Roe environment. So in June of 2022, Missouri became the first state to outlaw abortion after the Supreme Court decision, and that was under Missouri's trigger law that was passed in 2019. That bill in 2019 that was passed said that if Roe v. Wade was ever to be overturned and that authority went back to the state, that Missouri would outlaw abortion, and that's exactly what happened. In Missouri, there are no exceptions for rape or incest under the law, and healthcare providers who violate the law can be guilty of a Class B felony, which can result in 5 to 15 years in prison and have their medical license suspended or revoked. The law says abortions can be permitted in cases of medical emergency, but if folks have followed the news in other states that have similar provisions like Texas, Texas is not the only state, we know that these exceptions are not guaranteed to pregnant people, and medical providers and medical systems are operating under fear, confusion, and have to weigh personal and professional risk and liability. This is a map from Guttmacher. If you're not familiar with Guttmacher, they are a wonderful resource. They are a leading research and policy organization committed to advancing sexual and reproductive health and rights. And so they have been updating this map that shows which, as policies move, which states have very restrictive laws around access to abortion services, and really highlights that nearly 18 million people of reproductive age who may need an abortion no longer have access to abortion care in their state of residence. So really, in the chaos and confusion that erupted after the Supreme Court overturned Roe in June of 2022, abortion trigger bans that many states had on the books soon went into effect, which you can see on this map. Many other states moved quickly to restrict care. And so right now we have 14 states who are enforcing total bans with limited exceptions. And as a result, as I stated, almost 18 million people of reproductive age will have to leave their state if they need to access abortion and healthcare. And anyone denied abortion access in their state is forced to either overcome the enormous logistical and financial hurdles of traveling out of state, self-manage an abortion, or carry an unwanted pregnancy to term. Scenarios that are most difficult and carry the greatest consequences for those marginalized by economic insecurity and structural racism. So the proportion of patients traveling to other states to obtain abortion care has doubled in recent years. 1 in 5 people in the first half of 2023, compared with 1 in 10 in 2020, traveled away from their home state to receive abortion care. States protecting abortion access are trying to meet the needs of patients traveling, but it is an ongoing challenge for clinics and support networks to meet the needs of patients. Illinois, which borders Missouri, and other states that have limited access to abortion care. Illinois has experienced the largest increase by far in the number of patients traveling from out of state for abortion care. The state borders Indiana, Kentucky, and Missouri that all have very restrictive abortion laws. We know that there was immediate fear and confusion from practitioners on the ground after Missouri outlawed abortion. And this was not just for abortion providers, but for anyone delivering reproductive and sexual health care, wondering what they could say, what they couldn't say, how they would maintain the integrity of sexual and reproductive healthcare service delivery in this new environment. Missouri Family Health Council, at our organization, we observed calls from Missourians wondering if they could get a new IUD placed immediately so they were protected from pregnancy for as many consecutive years as possible. We heard from practitioners exhaustion, not just about the future of the field, but the years of attacks and restrictions they've endured leading up to this, as well as the impact of the global public health crisis on our public health. This work has always been very hard in a state like Missouri. And after dogs, advocates knew that it was only going to get harder. The messages they're hearing on the ground in Missouri and the threat of being personally liable can be very paralyzing, potentially for providers who want to give the best care to their patients, but feel as though their hands are tied because of institutions and new laws. And we know that we already have very dire maternal health disparities. States with the most abortion restrictions also have the worst maternal mortality rates. We know that Black women die at a rate 3 to 4 times higher than white women. And researchers predict that overall rates will increase and the disparities between white and Black women will also increase. We also know that there are a lot of disparities when it comes to accessing prenatal care. Pregnant people already facing inequities around that. And so making it harder to access care, sexual and reproductive health care, will only make these current statistics worse. So this slide is contraception at risk. It seems like a statement that might be hard to comprehend, but dogs really does go so much further than just touching abortion. And states like Missouri have long served as incubators for new attacks, not just on abortion, but on contraception, Medicaid, access to Medicaid expansion, and attacks on the LGBTQIA community. In 2021, the Missouri State Legislature attempted to reclassify some methods of contraceptions and ban them from our state Medicaid program. So this debate only a few years ago exposed really a fundamental misunderstanding of what contraception is and how it works. And it also exposed a belief by some that any drug or device that prevents conception is tantamount to abortion. This measure only barely failed after forcing a special legislative session and risking compliance of our state Medicaid program and the destabilization of our entire state budget in the process. And we'll talk a little bit more about that coming up. But I would say that there is an increase, there are increased policies being filed across the country around limiting access to abortion or to birth control. So less than a few days after Dobbs, panic over Missouri's newly enacted trigger law caused the biggest healthcare system in Kansas City to stop providing emergency contraception to survivors of sexual assault out of fear of prosecution. It took a statement at that time from the Attorney General, the State Department of Health and Senior Services, and the governor for those services to resume in June of 2022. Still, there are interpretations of Missouri law being amplified that are perpetuating confusion and fear that can harm patients, providers, and overall the health safety net. Unfortunately, once something like this happens, it can take a significant amount of time for the general public to get the correct information and facts about accessibility. Even though St. Luke's reversed course within about 24 hours, we do know that the damage was done. And we'll talk a little bit more about that in just a minute. So we know that there is a lot of misinformation, particularly online, about birth control legality, which is why Missouri Family Health Council, we have really made a concerted effort to assure its health center network and the general public that birth control, including IUDs, emergency contraception, and implants are legal and available nationally and in Missouri. And here we just have a few on the slide, top line outcomes from a recent poll. So we through the Right Time Initiative, which is, I'll talk a little bit more about the Right Time, but it's a privately funded initiative through the Missouri Foundation for Health. And we also worked with Missouri Foundation for Health and Power to Decide on this poll to poll Missourians to get a sense about what they believe or are unsure of when it comes to issues around sexual reproductive health care and from access to birth control and the legality around that. And so really just illuminates that there is a lot of confusion that exists in the public when it comes to accessing birth control and then also knowing what's legal and what's not. And so just wanted to highlight that. If you go to the Missouri Family Health Council website under our news and events tab, you can read the full press release on this recent polling that just came out in the spring. And it's just the second year that it's been conducted since my time at the organization. But what we really want to drive home for folks is just to reassure individuals that IUDs, implants, and emergency contraception remain legal in Missouri. And just anecdotally, last week I was talking to some advocates in the healthcare realm, and they were asking me about emergency contraception, and they were under the impression that it was not available and that it wasn't legal in this state anymore. And that was just a conversation that I had very casually with someone. But again, it just really illuminates that there's a lot of misinformation out there. And so we are really trying to address that through our programming. And then also when we do presentations like this to make sure that you're communicating that into your networks and your communities to reassure folks about what is available for them here in our state. So I'll talk a little bit about our, oh, sorry. So as we've discussed, we know there's a lot of misinformation and confusion among folks when it comes to accessing sexual and reproductive health care. And we also know that there are additional barriers to accessing care for many young people in our state, especially for young individuals. So on the slide, there's kind of just a list of things to be mindful about and different barriers that could impact someone's access or to be able to access sexual and reproductive health care. On the community side, there are providers who are qualified to provide the full range of birth control methods. Some methods like IUDs and implants, sometimes referred to as LARC methods or long-acting reversible methods of contraception, require providers to go through special training and to be able to place and remove the devices in the uterus or their arm. In a traditional system, more expensive methods are only purchased once someone has decided to use that method. For example, if let's say a college student came into a clinic and said they wanted to use an IUD, most clinics would say, okay, great, we'll order one for you. Go ahead and come back in 2 weeks and we'll get that placed for you. So not only does this exacerbate almost all individual level barriers like challenges with transportation, time off work, maybe childcare, it also creates additional space and time for unintended outcomes associated with sexual and reproductive health, like an unintended pregnancy. So on top of this, we have a system that stigmatizes and shames curiosity around sexual and reproductive health. So people are less and less likely to have access to medically accurate and comprehensive sexual and reproductive health, which means they have less of the information that they might need to avoid those unwanted outcomes. On the individual level, we've already talked about some barriers, but young people are disproportionately impacted by insurance status, transportation, and cost, in addition to being impacted by their ability to take time away from school work to get the care that they are highly likely, and they're also highly likely to be impacted by their personal support system and beliefs within their families. Okay, we're going to jump in to talk a little bit about the current sexual and reproductive health care services that are available here in our state, and go into a little bit more detail about some of the programs that I briefly mentioned at the beginning. So we're going to talk about Title X, which is a program that Missouri Family Health Council administers. That is a federal grant. We'll talk about the Right Time Initiative that we also administer. And then Missouri Family Health Council's new free EC program. So those first three are all administered at Missouri Family Health Council. And then I also want to provide some information and resources about the Women's Health Services Program, Medicaid expansion for adults, and then a new 12-month postpartum coverage under Medicaid that was passed in Missouri last year. And those are state and federal partnership programs. Sorry, wrong. Oh, no, I did. Okay, so Title X. So since 1970, Title X family planning clinics have played a critical role in ensuring access to a broad range of family planning and related preventative health services for millions of low-income or uninsured individuals. Title X is the only federal grant program dedicated solely to providing individuals with comprehensive family planning and related preventative health services. So Missouri Family Health Council, we have been administering this program for the last 40 years in Missouri. And Title X provides high quality, affordable, confidential sexual and reproductive healthcare services to anyone that needs them. Cost is never a barrier to care with Title X, even if you don't have health insurance or if you're underinsured. And then there is a range, as you see on the slide, of different services that are covered under that. And just to note that, so we have this grant that we administer, and then we work with a diverse provider network, including community action agencies, health departments, federally qualified healthcare centers or FQHCs, hospital-based clinics, and standalone family planning clinics, including the 2 Planned Parenthood affiliates in Missouri. And if you go onto the Missouri Family Health Council website, you can go to the patients tab and put in your zip code to find the Title X clinics that are in your area. So we have a really nice clinic finder. So hopefully it makes it very easy for individuals to identify where they're able to get sexual and reproductive health care services through a Title X provider in our state. So the Right Time Initiative, so this is also something that Missouri Family Health Council administers. The Right Time Initiative is a contraceptive equity program that is based really on the simple belief that everyone should have the opportunity to pursue the future they want, including if, when, and under what circumstances to get pregnant. This initiative seeks to inspire individuals to take control of their own health by improving information about and removing barriers to contraceptive services, recognizing that decisions always rest with the patient. The Right Time is committed to addressing persistent health disparities that exist around unintended pregnancy and historically marginalized populations. The Right Time is an initiative of Missouri Foundation for Health, and we administer the program. So tenets of the right time include evidence-based education and contraceptive counseling tailored to each client. Free or low cost birth control, meaning any FDA approved method of contraception should be available without barriers. Same day availability of contraception, which is something that we kind of talked about in previous slides with the different barriers. So same day availability. And that cost cannot be a barrier to accessing these services. So we can have this tagline of no insurance, no problem. And this initiative is about client choice. If someone changes their mind about the contraceptive method they choose, they can go back and they can try something else. We really want patients to be making the best decisions for themselves. And similarly to, so you can go on to the Missouri Family Health Council website or therighttime.org, but it links to it through our website to put in your zip code and find participating clinics that also administer the Right Time program for birth control. And so really user friendly, but I would also say that the Right Time website also has a lot of additional information on it about the different methods of birth control that kind of do a deeper dive. And so also an education opportunity for individuals to see what some of the side effects are of birth control or pros and cons that might be best for them as they decide to make the decision about birth control. I encourage folks to check out that website. And then the last program that I'm going to talk a little more extensively about is our free EC program at Missouri Family Health Council. So last June, so almost a year, we're coming up on it very soon, we launched the Free EC Project. And so Missouri Family Health Council wanted to help eliminate geographic and financial barriers to emergency contraception. We're committed to ensuring every Missourian has the ability to plan the futures they've always envisioned, which includes determining if, when, and how to become pregnant. The escalating tax on sexual and reproductive health care, we know that we're meant to diminish Missourians' power and autonomy, but it only served to really motivate us in our resolve and commitment to the movement. And so Free EC is just one tool for individuals to access sexual and reproductive health care. So we're just going to do a little bit of grounding about emergency contraception, some level setting. So emergency contraception is a form of birth control that's used by people who can become pregnant after unprotected or underprotected sexual contact. And it's something that you take, instead of taking it before, like other forms of birth control, you take it afterwards. EC, which is how I'm going to refer to it for the rest of the presentation, can be used to prevent pregnancy for many reasons. Some people use it when they weren't using another form of birth control or when their primary form of birth control failed in some way, like they weren't able to take their pills on time or a condom broke. Others may use it as post-exposure prophylaxis or after-exposure prevention of pregnancy in circumstances of sexual abuse or assault. Sorry, I don't know, mouse problems. Emergency contraception is very common. It's used by 1 in every 4 people who can become pregnant over their lifetime. And it is more commonly used in groups of people who are more likely to experience unintended pregnancy, including young people, folks in rural areas, and or with lower incomes, and BIPOC individuals. Another reference from Guttmacher Institute, again, a really great research institute. So emergency contraception pills, also sometimes called the morning after pill, are FDA-approved forms of emergency contraception. There's one type of pill that is available over the counter in the United States. It contains levonorgestrel, also known as LNG, a progesterone-only type of emergency contraception. This form is commonly referred to by its original brand name, Plan B, or other generic versions like MyWay, Option 2, and Julie. So you might have heard of those brands or seen them at your pharmacy. It is between 75 to 89% effective when taken up to 72 hours or 3 days after unprotected sex. Levonorgestrel is most effective for people at or below 165 pounds. The second type, Eupilistran, I have to say, sometimes I have a hard time getting that out as a non-clinician. Eupilaristyl acetate, our brand name Ella, is available by prescription. So this is a prescription, and it's closer to 85% effective when taken up to 100 to 120 hours or 5 days after unprotected sex. And Ella or UPA is most effective for people at or below 195 pounds. Both pills are most effective the sooner they are taken. A common misconception about EC is how it works. Emergency contraception works by preventing ovulation, but it won't work if the person has already ovulated or if they're currently pregnant. Neither of these EC methods affects an existing pregnancy. They are not abortion pills and they cannot cause an abortion.
Can I pipe in with a question real quick?
Oh, sure. Yeah.
Can you speak to what role weight has in effectiveness?
As a non-clinician and not having done that research, I don't know the answer to that. But I will say that in giving these presentations, one of the things that does come up, because there's a gap, for individuals that might not be in that weight range for folks. Of course, an IUD is something that can be used as emergency contraception, but that's very different than taking a pill and things like that. And so actually our clinical team in the last few weeks, I don't have any information today, but they were starting to do like a literature review around that to try to understand the gaps in that. And if there is any research being done to, is there something else that could be used that could be more effective for someone that might not be in that weight range? So I don't have a good answer, but that is something that I can absolutely follow up with the association when we get a little more, after we've done some more research on our clinical side, if that's okay.
Thank you. One more?
Yeah.
Can you speak to the legality of treatment for ectopic pregnancy?
So I know in the past that there were different proposals by Missouri lawmakers that would have complicated that care. So while things have been floated by lawmakers, there is nothing that has passed that would restrict access for individuals. And I will say that that was a couple of years ago, and my memory is not as sharp as to when that occurred. But I do recall really bipartisan reaction to that, knowing that that would be very dangerous for pregnant people and not to be something that could be pursued. And so I don't think anything this year around specifically ectopic pregnancies has been filed.
Thank you very much.
Yeah. Okay, and then just a few more facts about EC, including first and foremost that the medication is legal and available for people of all ages to purchase over the counter. So it is legal and available for people of all ages to purchase over the counter. Any and everyone can purchase emergency contraception without a prescription, but again, those living in rural areas and young people are less likely to have reliable access. So really trying to put yourself in the shoes of someone whose only access to EC is at the local grocery store or pharmacy, where it's possibly kept behind the counter. You have to ask for it, and you might even know the person dispensing the medication to you. And all of these barriers can inhibit a person from accessing the care that they need. And finally, one dose of over-the-counter EC can cost up to $60 per pill, which makes it inaccessible for those with low incomes. And really keep in mind that a person only has 3 to 5 days to take EC for it to be the most effective. So even with over-the-counter methods like the LNG pill, pharmacies and other stores are not required to carry it. Pharmacists can, in some cases, refuse to sell it, and store hours and security measures like keeping the pills behind lock and key add additional pressure and stigma around accessing this expensive medication. Like I said, usually costs about $60 per pill. So these barriers, especially related to stocking, transportation, and healthcare appointments, are only magnified in rural communities where the need for emergency contraception is greater. And all of these barriers exist once someone knows about EC, how to use it, and where to get it. And as I've said, since the abortion ban in Missouri, misinformation has circulated about EC's availability here in our state. So I'm going to talk a little bit more about what we're doing to try to reduce those barriers for emergency contraception. So individuals can go on to mfhc.org, our website, and fill out a form to confidentially request a free EC kit by mail. We really value and respect individuals' privacy, and you will not be able to tell what's inside the package. Names and mailing addresses are we destroy that, delete that information after the package ships. And we are only able to send free EC kits to Missouri addresses. All the kits are shipped via USPS and usually arrive within 5 to 7 business days. So ordering a free EC kit through our website is a preventative measure. It's something to have in case you need it. To keep in your medicine cabinet, to have for yourself or someone that you might know. And so that's a preventative measure. And we'll talk a little bit more about what happens when people, thank you, Heidi, for putting that in the chat, for folks that need something more immediate. But that is one thing that folks can do. They can go onto our website and we will ship that to individuals. And these are just a few photos of our free EC kit building project. We are a non-for-profit and we really rely on our dedicated, enthusiastic volunteers to help us assemble these free EC kits that have a number of things in them, not just the EC, which we'll talk about in the next slide. So this is just a visual for folks about what comes in each kit. So there are 2 doses of EC. There are safer sex supplies like condoms and lube. And then also healthcare resources. So we have information in there about EC, how it works, and then the Missouri Family Health Council's your priorities, your timing, about sexual and reproductive health care, and where to access ongoing services for individuals. So in addition to getting them through the mail, we have joined with health centers and other community partners to distribute free EC throughout the state. So just this week, we hit the over 71. We have 71 partners in the state that we're working with to help get these kits out. So it's a very diverse network and we're looking to grow that. So if your organization is interested in learning more, I'm happy to talk to you offline after this and get you all the details and the information. But we are working with health centers, non-for-profits, churches, health departments, student groups, college health centers, groups that work with folks who are unhoused, and domestic and sexual violence organizations and shelters. So again, if your organization or if there's an organization in your community that you think might be a good distribution partner, please let me know. I'll have all my contact information available. But there are a few different ways of promotion and engagement in this. And so we want partners to choose their comfort level of how they want to promote the program if they do join the Free EC project. So the most public facing, our partners are featured on our Missouri Family Health Council website, and they publicly promote the availability of kits at their location on social media, at outreach events, and in digital communications. And that list of those public partners, again, are on our website if you go to the Free EC tab to find it. And so you can see the folks that are listed on there. There's also an option for partners who want to offer free EC kits, but they don't want to publicly promote. So these partners are not promoted on our website or mentioned on our online social media, but the kits are available at their location and they can promote it within their network. So they might, in their emails and on their social media. And then finally, there's a partnership option for organizations or businesses who want to keep a private stock for their clientele or community members with zero public promotion. So an example of this might be an interpersonal sexual violence shelter. So individuals, they get the kits and the public is not walking in to obtain them. And so those are the 3 different ways for folks to join in. And then this slide just kind of gives a little bit of information about what the partnership looks like for if you do want to be a part of it. It's pretty straightforward. We provide the free EC kits at no cost to partners. The partners must agree to make the kits available to community members at no cost. And then the kit recipients cannot be required to participate in any programming. We really want folks to be able, no barriers, come in, pick up an EC kit and leave. And free EC partners cannot require recipients to meet with staff. And then once partners have distributed all the kits in their supply, they can either elect to close out distribution or they can put in a reorder and we send additional kits. Again, we're just asking folks to help us get the word out about this project. You can go to our website, help promote it. We also have a great social media toolkit. So even if your organization isn't able to or interested in having the kits, if you want to help promote the availability of it, we can also work together on that as well. And then the next slide is really one of my favorite slides. So we launched this in June last year, and we had modest goals. We had about 5,600 kits that we were trying to get out before the end of 2023. And then as of last week, we've distributed over 21,000. And so we've done that. I know it's a fun slide. We've done that in combination of mail requests, which are really putting a lot of advertising out there, especially in rural areas on social media to try to increase the access there. But yeah, we are at the over 21,000 mark. So we'll be celebrating. We're celebrating that right now, but we'll definitely be celebrating it and continuing this work. But I think that just really illuminates the need for this program and for individuals to access it. And like I said, in addition to removing those barriers, it's also an education campaign to let folks know that what is legal in our state, and EC is. Okay, so I'm going to jump a little bit to some other programming. So again, Title 10, The Right Time, and the Free EC are all programs that we administer at Missouri Family Health Council. But we also promote the state and federal programs like the Women's Health Services Program. And so that covers individuals ages 18 to 55 for families and different family planning related services, pregnancy testing, sexually transmitted STI treatment, PAP tests, pelvic exams, and follow-up services. They're covered by Missouri Health Net for uninsured women ages 18 to 55 with a modified adjusted gross income for the household size. So it cannot be more than 201% of the federal poverty level, which I'll show a slide around that in a moment. But contact information for the state around that program. And Rachel will also follow up with you with all these slides, so folks will have it. And then also we promote Medicaid expansion for adults. So in 2020, voters passed Medicaid, which opened up eligibility for hundreds of thousands of Missourians who prior to that were not able to qualify for health insurance through Medicaid or Missouri Health Net, the program it's called in Missouri. And so we are trying to let folks know that the eligibility guidelines have changed, and if they didn't qualify a few years ago or before Medicaid, that they might qualify now, or if there are any changes in their healthcare plans. So I just want folks to know about that. Again, mydss.mo.gov. Healthcare has lots of information about that program as well. So just want to do a plug for that. And also want to promote Cover Missouri. They are a great free resource for individuals, offers free help for folks applying for Missouri Health Net or Medicaid, and you can learn more at their website. And if folks are currently on Medicaid, they need to be sure to update their information. So if you work with any populations that are on Medicaid, like their address and other important information. So the state is doing annual renewals. Every state is doing this now. And it's very important for folks to update this information. So again, the DSS website and Cover Missouri, really great resources for individuals. And then the passage last year in the Missouri legislature, the 12-month postpartum coverage under Medicaid went through. And really this passage of this Medicaid coverage from 60 days to 1 year. So Before this, individuals lost, new parents lost Medicaid coverage after just 60 days. And so it has been extended to 12 months. And so this new policy will benefit about 4,500 birthing people across the state. And it's being implemented right now. And so just really want to highlight that program and encourage folks to learn more about that as well. And then I'm going to jump into talking a little bit about just staying informed and engaged. At Missouri Family Health Council, we really know the importance of policy work at all levels of government. Our advocacy seeks to increase health equity and access to reproductive and other safety net services through stakeholder engagement, mobilization, and advancing a shared policy goal. So these are some of our policy goals for this year around Medicaid. We have some contraceptive equity legislation, which I'll talk about in just a moment, promoting and improving women's health services program, and of course, defending against legislation that negatively impacts the health safety net, which we have been very busy doing this session. So these are three bills that we champion and support: annual supply birth control legislation, pharmacists prescribing of birth control, and then the Compassionate Assistance for Rape Care, or for Rape Emergencies, or the CARE Act, as it's sometimes referred to. So our annual supply birth control. So this is legislation that has had the most momentum this legislative session. And actually, I want to thank the Missouri Rural Health Association because you all testified for it in the House and just yesterday in the Senate. So thank you very much for your support on that. We are anticipating a vote tomorrow in the Senate Emerging Committee to see if that will go through. And there's about, I think, 10 days left of session. So but the annual supply bill provides an option to acquire a year-long supply of self-administered hormonal birth control at one time. So that puts Missouri in alignment with Missouri Health Net policy that already operates that for folks that use Medicaid as health insurance. But it also puts us in alignment with provider practice, public health recommendations, and national policy trends. This is a bipartisan measure with House and Senate sponsors from each party filing this legislation in 2024. And this includes pill, patch, ring, and shot. Those are the methods covered under the annual supply bill. And as I said, this has gotten the most momentum, has gone through the House, and now is on the Senate side. We are also very supportive of pharmacists prescribing of birth control. This bill has unfortunately not had the momentum of the annual supply, but this is law in 28 states, creates an additional pathway to care. And we know that pharmacists have a high rate of patient contact and are among the most successful healthcare providers, often seeing patients more than an annual exam or seeing their physician. And again, addressing barriers people face, lack of time, or lack of having access to a nearby clinic. Representative Engel and Senator McCreary are carrying that legislation for this session. And then the third bill, the Compassionate Assistance for Rape Emergencies, that's filed by Representative Ian Mackey. And unfortunately, this bill has not moved very far this session, but defines ER standard of care to include information and provision of emergency contraception if requested, and STI testing and treatment to ensure that that ERs are providing that and offering that to individuals. And it is law in 16 states right now. And a few other legislation I talked about being on the defense of and trying to protect the safety network. So one of those things is trying to fight the attacks on preventing Planned Parenthood health centers from getting reimbursement. So right now there's legislation that has passed in the House and the Senate, and it has been sent to the governor. And so the governor can either sign it or veto it. We are asking folks to contact the governor to please veto the defund of Planned Parenthood legislation. So This would bar Planned Parenthood from receiving Medicaid reimbursements for non-abortion services like annual exams, birth control, cancer screening, and STI testing and treatment. 20% of Missouri Planned Parenthood patients rely on Medicaid, and they should have the right to choose their medical provider that they want to go see. So really defunding Planned Parenthood is about furthering the stigma around sexual and reproductive health and taking away access. This would also mean delayed and denied care. Our safety net is stretched very thin as it is. And if we lost Planned Parenthood, and they are a very trusted healthcare provider in our state and for so many individuals, that we know it would impact so many clients because a lot of health departments or other entities are not able to absorb the clients that would not be able to be seen at Planned Parenthood. So as I said, that has been sent to the governor, and we are encouraging people through our advocacy and on our network. We have, if you go to our website or on social media, asking folks to contact the governor around that. This year, we've seen additional legislation around prohibiting diversity, equity, and inclusion in higher education, healthcare, and State Department contracts. This language has been attached to bills and budget bills, but nothing has been sent to the governor yet, but that could still happen in the last few weeks. And then also there is a lot going on right now. I think there's a filibuster happening in the Senate as I speak, or at least up to an hour ago in the Missouri Senate, around the federal reimbursement allowance. So as I kind of alluded to in 2021, the FRA came up to be renewed, and extremist lawmakers attempted to reclassify some methods of contraception around that and used the FRA really as leverage to meet some of their demands. And it sounds like there's some of the demands right now with the FRA being filibustered is around IP reform, which I'll talk about in just a second, and then also asking the governor to sign the defund Planned Parenthood bill. But this is a very important, the FRA tax is very important. It's billions of dollars in our budget, and it needs to be renewed this year. But unfortunately, folks are using this as leverage to push. It's a small, the Republican Party in the Senate right now, it's the Freedom Caucus. They're the ones that are really targeting this, but it is not all Republicans in the Missouri Senate that are leading this filibuster that's happening right now. So that's happening. And then lastly, doing away with majority rule at the ballot box. So there are attempts by the majority party in Missouri to try to make amending the Missouri Constitution more difficult. Citizens of the last, well, we've had the IQ process for over 100 years in this state, and advocates and citizens have used the initiative petition process and really engaged in direct democracy to pass Medicaid expansion, raising the minimum wage, both medical and recreational marijuana. And so it is a tool of democracy that citizens can use when lawmakers are not doing what they want them to do. And so now lawmakers are trying to make it more difficult and increase the threshold for any changes to our state. So the bill that has the most momentum right now in these final weeks of session is SJR 74. It is passed in the House about a week ago, and it has been sent back to the Senate, and the Senate needs to vote on it before it can be sent to the governor. But again, this would make it harder for advocates to engage in direct democracy and make changes to our state constitution. Which leads me into talking a little bit about, I've been talking about what's been happening under the dome, but this ties into what is also happening. Citizens are engaging in trying to overturn the extreme abortion ban in our state. So Missourians for Constitutional Freedom for the last several months has been out. You might have seen petitioners in your community or gotten things or seen things online, but they are gathering signatures. They have until May 5th. So this Sunday, to collect 172,000 ballot signatures. And then that will allow the measure to be placed on the ballot. We're not sure exactly when that will happen, so I'm not going to speculate on that, but it would be definitely in 2024. And so if you want to see the full language of that ballot measure, you can go onto the Missouri Constitutional Freedom website. Our organization has endorsed this measure. And so again, this will put it on the ballot, but then there will still have to be a vote in our state. And I'm sure folks, Missouri is not the only state that is engaging in this and having measures on the ballot in 2024 to try to restore access to abortion services in our state. And then just want to do a quick plug for our action network. So if these are topics that you're interested in, if you would like to stay engaged with our advocacy work, find out about upcoming EC Kit volunteering days, and just see the different things that we're engaging in, I would encourage folks to sign up for our action network. And we'll send you some emails. I don't think we bombard people too much. I know everyone gets a lot of emails about things. So just would encourage folks, that's probably the best way to stay engaged with our work. And of course, our tools, our vote, ballot initiatives, how to find rights at a federal level. There was a birth control bill in Congress that we're hopeful we'll get some momentum this spring around birth control access. But sorry, I know we're getting short on time, so I wasn't trying to like rush too much. I won't go into too much detail, but I will send, I'll have put this up here, but we'll send the slide deck to you, Rachel. I'm happy to follow up with different resources for individuals, but also just a brief list of different ways that folks can become engaged if you're passionate about these topics and you want to. We've got some suggestions there, but happy to answer any questions and want to make sure my contact information is up there for individuals. And I'll stop.